Hello and welcome to the 2021 Preschool Development Grant Birth Through 5 annual convening. We're so happy to have you join us for this event, and we hope that you are ready for a great week. This year, we are celebrating all the tremendous progress you've made in building and enhancing your comprehensive early childhood statewide systems. We're going to spend the week celebrating your successes, learning from national experts, and connecting with colleagues. We are pleased to host a series of sessions that provide opportunities for celebrating, learning, and connecting with a particular focus on this year's theme of leveraging strategic partnerships for effective early childhood mixed delivery systems. So I hope you brought your partners from across the state and plan some time together to join the state team time calls we've offered each day. So speaking of partners, there are more than 500 people representing all states and territories, as well as staff from technical assistance centers, policy organizations, and federal agencies. I want to thank you all for taking time to join us this week. I'd also like to thank all the presenters. I appreciate you taking the time to share your experience and your expertise. And I hope that next year we'll all be together in person again. So as we get this week started, we have several leaders here to share the federal priorities. We'll start with a discussion with Miriam Calderon, the Deputy Assistant Secretary for Policy and Early Learning in the Office of Elementary and Secondary Education, and Katie Ham, Deputy Assistant Secretary of Early Childhood Development with the Administration for Children and Families at the U.S. Department of Health and Human Services. After they set the stage with the federal priorities, we will have a panel discussion with Katie Meese, who's the Deputy Assistant Secretary and Acting Assistant Secretary of the Office of Special Education and Rehabilitative Services. She's joined by Dr. Ruth Friedman, who's the Director of the Office of Child Care, and Dr. Bernadine Futrell, the Director of Office of Head Start. So Katie and Miriam, can you get us started by sharing some of the federal priorities and how they align to the comprehensive early childhood statewide early childhood systems building efforts supported by the PDG B-5 grant initiative?
Thanks so much, Missy. I think I speak for both myself and Miriam that we're both really excited to be here today speaking with all of you. This is a really exciting time to be in early childhood at the state and federal level. There have been some enormous investments in early childhood with the American Rescue Plan Act, and some really big plans that this administration has as to how to move us forward. So when we think about kind of the overarching strategy and goals that this administration has, it's really thinking about a comprehensive birth to 5 system. And there are two kind of significant proposals that the administration has put on the table to that end. And I can talk about those a little bit and then would love to pass it over to Miriam to share a little bit more. What the administration put on the table as part of the Build Back Better plan is a $450 billion investment that would stretch across 10 years and really drive towards a system that makes early childhood programs affordable, accessible, and high quality for all children. There's a proposal to significantly expand investments in childcare to serve all low-income and middle-class families, to improve quality, and that really means improving wages, making programs more inclusive, building towards quality. The second proposal is around universal preschool for all 3- and 4-year-olds, regardless of family income or their parents' work status. It includes many of the same goals around quality. So building towards a system where there's wage parity with elementary school teachers for those who have the same degrees, a mixed delivery setting that allows families to choose between a school, a Head Start program, a family childcare program, a childcare center. So we're really meeting the needs of families that want preschool for their children, but also have priorities like, wanting a full day, full year program while they work. And mixed delivery can really help meet all of those diverse needs that families have. So the administration is really driving towards major once in a generation investments. We are just about at the 50-year mark since President Nixon vetoed the Comprehensive Child Development Act. And it really feels like we once again have this opportunity to take a giant leap towards that vision. And I think we're really excited to be in partnership to build on some of the success that you all have achieved through preschool development grants, and think about how we can use these potentially 2 new programs to advance the agenda even further. And Miriam, I'd love to hear what you have to add on to this.
Thanks, Katie. I'm so happy to be here and really appreciate everyone tuning in. We know how busy everyone is right now, and the work you're doing. Yeah, it's great to be able to carve out this time. I would just, Katie does such a great job of really talking about what's in the Build Back Better Act. And I think I would just sort of put it in kind of plainer terms, like this, our administration's focus is to create a more equitable, fair early care and education system. It's to be able to eliminate race, income, zip code, immigration status, a child's ability or disability as a predictor of whether or not a child or family has access to a high quality early care and education experience, beginning at birth through the start of kindergarten. So I think as Katie explained, it's currently in Build Back Better Act that's making its way through Congress. It's our moment to finally finance early care and education systems in states and really to transform a system from one that's primarily parent funded to one that's publicly funded. It's an opportunity, I think, to think about access and quality. Equity is equally about both. It's not just about a slot, I think, as everyone knows here. It's what the child and family will experience through that program. So I think that's sort of a really important lever here. And I think to the second part of your question, Missy, in terms of what does it mean for comprehensive systems building efforts, I think I would say one is, I would think about it this way, having come from Oregon and 4 years in a state, like think about early care and education as its own sector, as well as the connections to other sectors like health, human services, K-12, housing. This transformation and this opportunity that we have before us is a huge moment when we think about our systems building first as ECE as its own sector, because we don't, I think, probably have very many systems initiatives like our workforce strategies, professional learning, infrastructure locally, childcare licensing. I guess what I want to say is everything associated that touches ECE sector right now is subject to the same fragmentation by funding stream. We don't have the same kind of intermediary organizations locally that can support quality, that can support the workforce. We've siloed how families find out, enroll, get outreach around a different funding opportunity or slot opportunities. So we've got, as everybody knows, different program standards associated with funding streams. We have different levers regarding on whether a publicly funded dollar touches a program or service or not. So it's major work to think about data systems, workforce strategies, governance, shared standards, all of these things that are part of comprehensive systems building to actually realize a mixed delivery system for ECE, where any one of these systems or programs or initiatives that we have to support quality, to support families, to finance, to fund or subsidize the costs, how it works across all of the different settings where we know early care and education currently takes place and will be expanded through the realization of Build Back Better. So it's an exciting time and a lot of work. So I would say think about that infrastructure in addition to planning for this opportunity.
So Miriam, you just mentioned a couple gaps and challenges, I think, in doing this work. And so I wonder if the two of you have any, what What would you be encouraging states to think about, especially as you have this new funding opportunity? Are there some things that you think and would encourage them to think more creatively about critical components of the systems, whether it be workforce, you mentioned data systems, you mentioned governance, all these critical pieces? How would you encourage some of the states to be thinking more creatively?
So I think I would take a step back and think about, for so long, we have operated in this scarcity environment. To Miriam's point about other sectors, I feel like early childhood is used to kind of being the sector that is chronically underfunded, underinvested in, and it can be difficult to think about what is possible when there are resources on the table. So as you think about things like the workforce and governance, parent choice, I think it's important that we not maintain that scarcity mindset and we think about what's possible in the system that we want to build for children, for families, for early childhood providers and practitioners. What do we actually want to get to? What's the vision that we have? And feel like we can put that vision on the table and think about what it would take to get there rather than being so constrained. So we have and states have now the American Rescue Plan Act funds. Those funds can be used to address some of the workforce and parent choice and data issues that states have faced for a long time. I know that the jurisdiction for childcare and PDGs is not always the same in each and every state, but hopefully you all are at tables where you can have some of those discussions about how can we strategically use some of those resources in a way that gets us to those goals. So I would really think about here and now, how can those resources advance your goals? And I would just underscore that that's especially true on the workforce. So we know that many states are facing a shortage when it comes to the early childhood workforce, and those resources in ARP can be deployed to address some of those workforce shortages and do wage supplements or wage increases, increase provider payment rates. And while I know that the PDG role is different than the child care role, you have the needs assessment. You've made some of these broader plans, and bringing that together with some of the resources that are currently available, especially to plan for what might be in the future, I think is a really valuable exercise, and something that we should not waste any time doing. We should definitely be thinking about these opportunities and how we bring together the plans that you all have already made and the work that you've already done to identify what the needs are for children and families in the state, and how we kind of move that forward in an environment where there are resources to do so.
I totally agree with Katie and all her points, especially just want to, I think, emphasize the point about, operating out, getting outside of like a scarcity frame in thinking about our systems building work. That isn't at all to say that we have, that we don't have like finite resources, including for systems building, but I do think it is important to get, I think, outside of that right now and to really start to think about scale and what this infrastructure would look like at a state level and locally, that would really support a much more robust system, set of supply of high quality early care and education that exists in states and communities. And so, I think it's a really exciting time. It seems the resources are coming. I know at the same time there will be, if I believe, I guess I should moderate myself. I believe the resources will come because I'm going to be an optimist right up until I have reason not to be, that the administration and Congress is going to get this vision over the line. But so, as I think it is sometimes, I think, challenging to think about, you know, expansion and slots while you know that you're building kind of the infrastructure and capacity that's needed. And we know, as Katie talked about, there are some really daunting challenges before us right now in the immediate couple of years as the resources are coming in, like facilities, like workforce, like data. Infrastructure. And so, that kind of data to help us make the best decisions to drive, I think it's huge to be able to operationalize equity. And we're going to be fortunate in terms of implementing this in a place of, love the data that you have and try to make the best decisions that you can while you're setting this intention of getting the data that you ultimately need, right? To be able to ensure that we've capitalized on this opportunity to be able to advance equitable access and equitable access to quality. So I think the creative part, again, is to think at larger scale, and then kind of hone back in as when you have a better understanding about what your resources are, but think about kind of that North Star. And I think this may lead into kind of the next question, but I think for all of these, the maturing of all of these different systems and the advancing and building this infrastructure, it has got to involve thinking about those who are most impacted sort of by these systems and who will be the end users of these systems. And I know that is a part of all of our work. But I think that is going to lead to more creativity. That is going to get us out of a scarcity mindset of resources, and that will ensure that we have this sort of maybe once in a moment opportunity to get from where we are to a much more robust system that can support a mixed delivery ECE sector. And if we're building it, we've got to start building it from the beginning, knowing, or getting to the next level from wherever we are, knowing that we've done so with the input of who the end users are going to be and the beneficiaries, whether those are providers, families, our intermediaries that support quality. They have to be part of all of these conversations, our other sector partners.
Yeah, so I think that's a nice segue to we talked about how to think a little more creatively, but there's the practical nature of that. So what practical advice, and I think Mary and you were just getting into some of those strategies, how would that look? What are some strategies you give to the states as they think through how to implement this work and maybe get the buy-in from others who maybe not be joining us today, but we'll have to get other stakeholder buy-in from their states? So what advice would you all have?
I feel like Miriam was on a roll, so you should keep going.
I don't know about that, but thanks, Katie. I think, I would, I think I would say that number one is, I think going back to that sort of like the end user, a beneficiary of the services piece. I don't think that, I just think that is just so critical right now. Let me say it that way. Like, we absolutely have to be asking people for their input and advice. And I would just say that scarcity of resources, where we've been for, decades now, impacts people's ability at all levels, right? And like what the family could absolutely think they could ask for. So how you do it matters, like, has been moderated by this like reality of decades, I think, of scarcity, trade-offs between access and quality, hours of the day, a slot for my 4-year-old, but not for my 1-year-old, right? Like in my community. So I think going to families, going to the workforce, going to our partners, and thinking about like how you might ask the question, and ask people to like think about to step outside of the constraints of what is now and imagine what like they would like it to be, and give people permission to have like the blue sky idea. Again, not knowing that maybe we can't get there, or you can't get there immediately, but to help shape, I think, your North Star. So that's one. I think the other is relationships. I think for a mixed delivery system, I would be thinking right now, like, how are you fostering relationships across all of the different providers and partners in a community at the state level? What can you be doing to facilitate that? I think keeping as your North Star that the decisions that are going to be made in your state and locally are going to be the ones that have the greatest potential to take this opportunity and actually realize justice, racial justice, social justice, all that we know is possible. So, no pressure, but I think it is, having those conversations. And I think start planning now as if it is, I keep saying this, like as if this is going to happen, because even if it doesn't, you'll be farther along.
Yeah, I would +1 to everything that Miriam said. Definitely the time to start planning. If you haven't already, I know that many states are already thinking about where they want to go and planning for what comes next if this happens. And there are even a few states who've put together 2 or 3 year plans as to how they can build out a system that they hopefully in the future will have resources to build upon. Would also underscore what Miriam said about the end user experience. I think directly impacted providers and parents can provide a lot of input as to what kind of system works for them and can help identify the pain points on the front end to make for easier implementation down the road. So if there are not already tables in the state where that input is gathered, or channels for people to provide input, I think that can be a really valuable experience. The other thing I will say is I just think this is going to be a marathon, not a sprint. And it's already been a long 18+ months of doing this in a pandemic and providing services to children and families. So would also encourage people to look at it that way, and for yourselves as well, to take time away when you need time away. But also think about, sustainability and capacity in your state. It can be difficult to convince people to build capacity at the state level, but it's so important to have the capacity and not create a lot of burnout because people are just so overwhelmed and overworked. So any ability to kind of build out structure and capacity at the state level, I think is hugely important. And then I think the other thing is just educating other leaders in the state who can be advocates for early childhood. I think it is very clear that the early childhood sector is getting more attention than ever before. That's true in the media, that's true amongst our political leaders in the White House and in Congress. President Biden visited a child care center in Connecticut on Friday and met with a lot of the kids and parents and teachers there. So it's really a moment to be able to educate others in the state about the importance of investment, about the importance of building out the state's governance capacity. And that might be true of elected officials, it might be true of other administrators in the state that are kind of now seeing this issue, where when there's a little bit more visibility, and might be allies who can support your vision and your implementation efforts.
That's great. Thanks for sharing that advice. So I wonder in the last few minutes if there's a question you'd like to talk to each other about.
I always like to pick Miriam's brain on Oregon. So I would be curious, thinking about PDG in Oregon and working across the early childhood sector, or looking across the early childhood sector and other programs. What were some of the most valuable strategies on PDGs?
Oh, wow. I didn't get this one in advance.
Sorry, I did
Okay,
say I was
that's
going to send it
okay.
to you in advance, and then
That's okay.
until Missy
No,
reminded me, I
no
forgot.
worries. No worries, Katie. I think that you know, we had with our state early learning council and our early learning hubs, and just a great foundation for so many things in Oregon, like the full you know early childhood system vision, sort of realized and raised up Oregon. And I think, prior to getting the PDG opportunity, and then in the context of our state strategic plan, Raise Up Oregon, we were very intentional about creating this early care and education sector. So the PDG opportunity, and we're already very committed to mixed delivery. And so there's just a lot of assets to build on there. But so I would say with PDG, we were thinking about supply building, and we were thinking about kind of building that infrastructure and thinking about ways to align across these funding streams. So I would just say probably the things that come to mind the most are, one, we started a pretty robust effort around coordinated enrollment, outreach, eligibility, being able to work across all of the different public funding streams. And we're fortunate that we had our sort of early learning hubs already in place and that had existed for years, that could play that intermediary role in a community to start to bring all of these different partners together to be able to maximize all of the funds that were coming into a community, and to be able to think about how families were supported and really understanding what all of those choices were. The other thing that I think was really important was sector plans. Our same hubs led the development of early care and education sector plans. Both of these initiatives at PDG, I would have said as I was leaving, I'm sure they're farther along now. We're like at the 10-yard line of where we needed to be, but like that's where you need to start, right? And we had families giving input, and I think we're just going to get better and better at that in Oregon, of giving input into what the supply should look like in their community. And then the connection between the two, ideally where the state puts slots, where a community puts slots, how we go about building supply should be informed both by those sector plans, right? And where we know there's capacity and support around the coordinated enrollment. And then I would say finally, we were trying to innovate with supply building in PDG as well. So we thought a lot about how to use kind of some of those levers to pilot things. Like we started a pilot in rural communities where a small family childcare provider could get an enhanced payment through by serving infants and toddlers and preschool age children. So there were just a number of things I think where it was a way for us to think about testing different and piloting different strategies with supply building, that if there are more robust resources, hopefully we'll be farther along in knowing, available through BBB, like what the impact of some of those supply building efforts were. My question to you, Katie, I know we're probably on time, is you are a mom of two young children. You've navigated the complexities of the childcare system. You currently use like publicly funded preschool. What does high quality mean to you? What does equity mean to you, coming from it from a perspective of a mom, and what you experience or what you want your children to experience?
Oh, wow. That's a really good question. That's a huge question.
Yeah.
So we live in DC, and my son went to public preschool in DC public schools. I will say, so the quality component, to me, the meshing of the standards in the public schools and childcare licensing and Head Start program performance standards led to just an amazing high quality experience for my son. But the other thing that it was just because of our school's focus on it was around supporting dual language learners and really being led by what the data showed was most important for dual language learners and really centering what those families needed in how they developed the program. And then a huge focus on socio-emotional and being good citizens, but really just meeting the socio-emotional needs of each and every child and putting that first. Our childcare experience was wonderful. It was not a diverse experience because childcare costs at the center cost over $20,000 a year. So I really feel like being enrolled in a public program has shown us the value of what it means to have equitable access for all children in the city. And so that is definitely a point that we learned through our experiences going from a privately funded childcare program to a public setting where there was just more equitable access. But we were lucky to have high quality NAUIC accredited childcare. It's just very limited here in DC. So
Thanks, Katie.
Thank you.
Well, thank you both for taking the time to share some of the federal priorities. I think at this point, we're going to have some of your colleagues join the panel. And then at the end, we're going to bring Katie and Miriam back. So thank you both for being here. I'm going to invite Katie Neese and Dr. Friedman and Dr. Purcell to the panel as we get started. Welcome, everyone. Thank you for being here today. Let me wait for Dr. Purcell. And I have a series of questions. I'm hoping you all can share a little bit more about how your offices and your organizations are supporting this work that the states are so excited about doing over the next couple of years. So Katie, if you don't mind, we'll start with you, and I think we'll have Dr. Friedman, Dr. Purcell add to this. But what are you doing in your office to implement these federal priorities that Katie and Miriam just laid out a little bit more about?
Sure. Thanks, Missy, and good afternoon, everyone. I'm Katie Neese, and I'm with the Office of Special Education and Rehabilitative Services at the U.S. Department of Education. And OSERS, as we call it, has two main components. One is the Office of Special Education Programs, and we oversee the state implementation of the two special education early intervention programs, the early intervention program and the special education preschool program that serve about almost 1.5 million kids, or a little more than that, every year. We also have within OSERS the Rehabilitation Services Administration that provides job training and employment services to adults with disabilities. But in addition to our monitoring role, we, OSERS and OSEP, provide technical assistance to supports to states and parents in the implementation of high quality early education programs. So that's a little bit of what our office does.
Dr. Purcell or Dr. Friedman, would you like to share a little more about what your offices are doing with this priority?
Sure, I'm happy to jump in. Hi, good afternoon, everyone. My name is Ruth Friedman. I'm the director of the Office of Child Care. We have had a very busy year. The funding for our child care program has increased by 5-fold over the course of the past year because of the investments with the COVID emergency. So instead of just running a $9 billion CCDF program, to states mostly focused on providing vouchers to help subsidize the cost of childcare for low-income working families. We have been partnering with states to stand up a brand new stabilization grant program, which is designed for states to send money directly to childcare providers, all kinds of childcare providers in their states, including those who do not participate in CCDF program. And this program is really geared at trying to undo some of the damage of the past 18 months that COVID has wreaked on the child care system. So we have been working closely with states to get those brand new types of programs up and running and money out the door to help providers keep their doors open. We have been working to strongly encourage states to increase provider payment rates and increase staff wages. This is one of our top priorities as an administration. We are seeing challenges across the country right now with teacher shortages, and really are hoping that states use this unprecedented money to move aggressively to help increase wages throughout the workforce. And we have also been putting out lots of resources and technical assistance. I encourage everyone to visit our website. We have been adding resources regularly, including frequently asked questions and different charts illustrating the allowable use of funds, information on state case studies, because we have a number of states doing really interesting and exciting work. And we are also holding ongoing office hours so that CCDF lead agency personnel can come to us regularly with any questions or needs or resources for the TA Center staff, as well as representatives from OCC, and do some sharing with their peers, which we think is one of the best way for states to move forward with their own plans. So it's been a really exciting year, and we are looking for another big year ahead of us.
Thanks, Ruth. Hello, everyone. I'm Dr. Future. I'm the director of the Office of Head Start. I'm happy to add to this. I am a Head Start, former Head Start assistant teacher and a Head Start baby. I do want to just start by saying thank you to everybody who's on the line that really supports and has been leading this work, as Ruth and even Katie mentioned earlier. You know, we're coming through something we've never come through before. And we're also at a moment where things that we've been talking about as big ideas, big dreams, things that felt very impossible are now conversations that are at kitchen tables across our country. And that does not happen without great leadership. And that great leadership is from all of you, including our Head Start collaborative offices and all of those who are Zooming in today. So we're ready to work. That's our commitment. And at the Office of Head Start, we're focused on moving Head Start forward and in alignment with the federal priorities. The Secretary Becerra challenged all of us to say, think big and keep families at the center. And so as we do this, our focus is how do we lean into what we know works well and really do our best to support that. And where I would just kind of encourage echoing and supporting and just amplifying any efforts to prioritize and support the ECE workforce, our Head Start workforce. The Office of Head Start has issued guidance to our Head Start programs around the use of the American Rescue Plan funds. As you all know, Head Start as a program received $1 billion in ARP funds to really get back to in-person services to prioritize our workforce. And we're encouraging programs to really use that, those monies to do that. And that money has been given out. So what we can do to amplify those who are using it for incentive pay. I really want to talk about incentive pay for those who have been working the 19 months of the pandemic. What can we do to support them? And how can we use the American Rescue Plans to recruit others to really help cover this load? The other thing that we're doing that's connected to what we call our Head Start Forward initiative is around getting back to in-person comprehensive services. Miriam talked about equity earlier. That is a priority for the administration. It's a priority for the Office of Head Start. And we know that the ideal environments for children and families are in-person services and programs. And so we're doing what we can to really support that, encourage that to happen by having robust training and technical assistance for our Head Start programs on how to do this safe and effectively, because health and safety is number one, always. But as we look at equity and getting back to the many children and families who are disconnected from services during this pandemic, that is a priority of that. And then the final piece around our TA and our Head Start Forward is looking at how do we support our programs in layering funding, using the different funding streams, be it the ARP or other sources, to really have a unified approach to early childhood education that puts the child and family at the center of all of the decisions we make. And so, again, I thank you all for this conversation, for your leadership, and looking forward to learning with my great colleagues here today as well. Thank you, Missy.
Well, thank you all for that great introduction about what your offices are doing to implement these federal priorities. I'd love to hear a little more about what you're most excited about seeing happening in the next year.
So I'll jump in, and I want to just build on what Dr. Futrell said, it's a unified approach. And that's, I will say, it's the thing I've been most excited about since I joined the administration about 14 weeks ago. And what Katie described her experience in childcare, but really what we're trying to build is a unified system where all kids can have access to high quality, developmentally appropriate services that meet their unique needs and help them learn and grow and thrive. And what has been exciting for me personally is to get to work with these amazing colleagues who are all on the same page. Everybody wants the same thing for the same reasons for the same kids, and to really look at this historic opportunity to really construct an early education system that genuinely meets the needs of all kids. Tomorrow, the Department of Education is issuing a major resource on mental health, behavioral health, emotional health for states and districts and Head Start providers and other early education providers. And I was thinking about a DC program that I'm familiar with that had a really cool 4-year-old classroom that had in the corner a place where kids could sit down, and they had these ginormous emoji pillows. And it was trying to help kids identify what they're feeling. And so in order for them to be able to act on what they're feeling, they had to know what it was first. And how that can be really essential for every kid, whether you have an identified disability or not. And if you're an angry 4-year-old, you're not going to learn. And if you can help an angry 4-year-old turn into a happy 4-year-old because you helped that child figure out what's going on and address it, that child's going to be a much more successful learner. And we know that developmentally appropriate services matter. We know that having classroom staff be able to work together to help modify curriculum so all kids can learn, all of those things are really baked into what we're trying to do right now. And as with everything, the child and their family are the center. And the other thing I'm excited, and I will stop talking soon, but is the notion of really leveraging all the assets in a community. So it's not just Head Start, it's not just the public schools, but it's community-based childcare providers, family childcare providers, and really looking at what is the early childhood infrastructure and how do we support it so that regardless of what door a family goes through, they have high quality access to high quality services, not only for their child, but for their family. So it's a very exciting time. We have historic opportunities for resources to really make this possible for more and more children. And building off, I think, the unbelievably important and valuable foundation that the Head Start program gives all kids, but especially for kids with disabilities, that these things together really can change the course of our country. And so I'm excited for those reasons.
Thank you. If I could share, can I just say I agree with everything you just said. It's such a great moment that we are in. And what I'm super, super excited about is that we have a unified approach to build back with the family and child at the center as the anchor, as the cornerstone for what it takes to move forward. And I'm thrilled because this momentum that puts children in the center really helps us to think about the different inputs in the life cycle there. And then also it helps to shift what we expect of our programs, what we expect of ourselves, because we now have a new focus on what we are expecting for children and families. And so it's, the old adage about, if you have the intent without the system, it's just a good idea. But now we have the intent and we have an opportunity to develop a system that kind of can hold this big idea and really allow it to scale and serve children and families in new and innovative ways. Like that's super exciting. I think figuring out how we get there and knowing that we have strong partnerships, strong leaders. You heard from Katie and Miriam earlier, as well as others who are really pushing this and saying, we all agree, we all agree on the outcome and we all agree on the input. And now the space and time to get there is where we are. So I'm thrilled and really excited about that shared commitment that we now all have.
If I could just add one more thing, and sorry, Ruth, sorry. You shouldn't go without saying that the early intervention and related services personnel that work across agencies, across families, are essential part of that. So my apologies to my team for not mentioning you directly. It is the OT, PT, speech folks, it's the school, the social workers, it's all of those folks, it's the nurses that are there to help make high quality be high quality for everybody. So I just needed to do a shout out for that. So Ruth, sorry.
That's all right, Katie. I just wanted to reflect on the fact, I think from everyone that has spoken today, like there is just this sense of excitement that we are in a moment here of finally building an ECE system that puts children at the center and gives children and families what they need. I think we have for too long run particularly our child care system on the backs of parents and a deeply underpaid workforce. And we are all just really exciting in the coming year to show what is possible when the system is not as seriously under-resourced as it has been, and how we can move forward a system that really puts children at the center.
That's great. It seems like such a wonderful opportunity. And I'm glad to hear you all kind of talking about this unified approach, because we all know as early childhood, that's what it needs, because these children are not served by any one program, but often by many. And so I think, and maybe Dr. Fertel, you can get us started on this one, but I think, how would you recommend for states who are listening today that they contribute or they kind of engage the stakeholders, let me frame this question right, to the systems building activities, especially these are PDG B-5 grantees and Head Start and early childhood special ed, EI, Office of Child Care. Many of your program offices have played such an important part in implementing the PDG B-5 grant. But how do you really get them to engage around this work and continue this work sustainably?
Thank you. It's funny, I want to go back to that first question about what we're excited about, so Head Start programs are hubs in communities and across the nation to really bring resources together, to partner with families, to identify community needs. Head Start as a federal to local program, we really lean into that expertise in the community to identify what works best. What's the best way to organize your resources and your supports for children and families? Last week, I had the pleasure of visiting a Head Start program in Allentown, Pennsylvania. They call themselves the Hub, like the name is a hub. And so when families walk into the Hub, it's a place that is about what's best for that child and that family. And I know we're talking about building a systems approach, but as my colleagues have shared, it's about starting with that unit of impact, that unit of analysis as the individual child and family. And so when you have that perspective in a state, a community, it's more about getting to know the needs of the community, understanding the opportunities that are there to really support the goals of the individual family. And so the Learning Hub, what they do is they bring you in and they say, let's have a conversation about what your needs are. And we may offer you an opportunity to enroll in this program or that program, because it's about, and Katie mentioned earlier, like moving away from a scarcity mindset or a competition mindset, but moving to a mindset that says, what does the early learning ecosystem look like in my community? And how can I ensure that families who can benefit by a partnership with Head Start's comprehensive services are really at the forefront of getting access to that? How can I ensure that the needs that might be unique and different are really held up front? So my commitment is to look for and share out these practices, these effective family and child-centered practices. And I would ask all of my colleagues that are working in states across the country to do the same, because it's about having that culture of what's best for this child and this family while we continue to build a system that is interactive and grows like an ecosystem, grows and supports because all parts are strong and supportive. So the Learning Hub and that moment and that experience, that's just one example. There's so many other programs that are doing that. And so just amplifying and just saying, this is what's possible and focusing our efforts there. I think that's what my ask would be.
Dr. Friedman, do you have anything you'd add to that?
Sure. Certainly Dr. Futrell's answer, I think, speaks for all of us. Childcare is foundational and pivotal to the success of the PDG Birth to 5 grantee strategic plans, because that's where kids are for the most part. And we really want to make sure that there are coordinated services that families and children that they need that be available in all settings, including childcare and family childcare. So I think it's really important to have CCDF state administrators at the planning and implementation tables. Particularly, this is true now more than ever with the additional COVID funds, of course. But I think through the from the inception all the way throughout is just a really crucial piece for childcare to be at the table.
Go ahead, Katie.
So what I would add to this conversation is, continue doing what you're doing to collaborate. We've seen great progress with the maternal and infant home visiting program and Part C and the 619 special education preschool services program. We need to continue to collaborate on professional development so that we're training people about the same thing, and they may come at it from a different perspective, but we need them to be trained to the same child and family centered, developmentally appropriate, high quality goals. I think the other thing is we need to do everything we can to have our service system have high expectations for all families, and to not have race or economics or disability or some other status by default have us place different expectations on those families, because that's just a huge barrier in too many of our communities. We are at the Department of Education working on a set of guidance on Part C child find and how to implement robust individualized family services plans under IDEA. And I think as we're looking at systems, how we can best identify those families. Over the years, the early intervention program, most kids have received services in their home. And while those numbers are changing, it's still about a 90-10, 90% services in their home, 10% services in the community. And I think the economics of our country is, in most families, both parents have to work. And so we want to give more opportunities for families with young children with disabilities to be able to access childcare. That will only happen if childcare providers are trained that they can do it and that they don't have to do everything themselves, that there's a whole service system available to support them to meet the needs of these children and families. But I think we still have a ways to go to help people accept that premise. The last thing I would say, and it goes along the lines of high expectations, is that all children, regardless of if they're low income or from racial ethnic minorities or from non-traditional homes, are children, right? And they come in families. And our task is to support them in their families to facilitate their healthy growth and development. And so I think as we go forward, that we want to look and find every family that we can support and then help them where they are, recognizing that families are in different stages of development as a family, and the needs of their children are going to evolve over time, and that we need an early education system that will evolve with them.
Wonderful. Thank you all for that. And I do want to understand, so I want to make sure because I didn't want to miss anything. So Dr. Petrelli, you mentioned you wanted to respond to the excitement question. Do you want to go back to that and add what you're most excited to? And I want to make sure that you get a chance to respond to all questions. So feel free to jump in.
No, that's actually perfect because Katie kind of mentioned what I'm excited about. I'm excited that we have this opportunity. So yes, we are recovering and building back, and we're trying to reconnect children and families to programs, to education, to services, etc. But I'm excited because we now have we have the resources to do that, to go and find children and families. And what's of a particular interest for the Head Start program is identifying children and families who may be experiencing homelessness, children and families who are, because as a result of this horrible season we've been in, are now can now benefit from some of the services that they may not have even been aware of before the pandemic. And so we have the resources to kind of go after and find and connect families and children in programs and really provide that support. So yes, we're excited. The one answer about a unified approach and supporting those families and supporting and the systems that are in place, but it's also a moment like never before that we can aggressively go and find children and families and enter and bring them into a cycle of learning. And this, it's a unfortunate how we got there, but it's also exciting that we have this moment, the resources and the momentum to connect children and families to this cycle of learning.
That's wonderful. Anything else you'd all respond to anything that you've all said amongst each other today? All right, well then let's bring Katie and Miriam back and we're gonna open up. I have a series of questions I'm seeing come in and some comments for those. The panelists may not be able to see the chat, so but folks are really responding and appreciating your comments about children and families being at the center of this work. I think that's great. So there's this kind of idea of the parent role, and this has been kind of something that's clearly resonated with this group. There are also some questions that have come in. So we'll start with the first one and then we'll just let you all kind of respond in whatever order makes sense. But the first one says, I hear the excitement, but what advice do you have for states that are concerned about the sustainability of the new federal funds? Anybody want to start us off? There you go, Katie.
I can start. Just to take a step back, the American Rescue Plan funds that are available to states now, those will last for another couple of years. The Build Back Better proposal is longer term, which would provide more sustainable resources to build towards this system that we all envision and want for children and families. So I agree that the sustainability is really important. I would also add, though, that for decades, we have been sharing to anyone who will listen that the reason why we haven't been able to make as much progress as we would like in early childhood is because of underfunding, and that impacts what families can access. It impacts quality, it impacts wages, and that's really held us back. We need to seize this opportunity to show what is possible when we have a well-funded early childhood system and the ways in which we can make progress that makes a difference for children and families. I worry that if we can't do that, if we can't show that progress and show what's possible with the right investment, then we will miss our opportunity in the future as a result. So we can't get into a cycle where the reason why we're not making progress is because we might not have money in the future. It is true for almost every federal program that they don't exist in perpetuity. Congress has to act to extend them from time to time. But we need to be able to show our elected officials what we can do when we have the right resources and when they can provide the right resources.
I mean, I totally agree with all of Katie's points. I think I'll just say, that is, you're not, I think you just have to there's always some risk involved. I think to Katie's point, we're always subject to sort of the state budget cycle, the federal appropriation cycle. In Oregon, we used some of the federal federal recovery funds to address copays. Oregon had some of the highest parent copays in its childcare subsidy program in the country. And we lowered them to meet the federal standard, and we were able to cover that over 3 to 4 years. So we, that money isn't, we are relying, as Katie said, the state will be relying on additional federal funds, potentially through Build Back Better, to be able to sustain that. But, I bet we as families who are benefiting from that right now and the impact that's going to have in 2 to 3 years, I bet it's pretty significant. And it was one of the best choices that we could make. So I think when you're trying to do transformational systems change work, whether you're this is a 4-year PDG grant or federal funding, you're always going to be on some bit of a ledge there of trying to get to somewhere else, making the best decisions at the resources that you have. But I think that's the point, I think, of systems building work. And so it's definitely a balance, but you want to get as far as you can with the resources that you have at the time to give children and families what they need now, and to move you towards the system that you ultimately want to have. That's everything that my colleagues just talked about, equitable, child and family centered. So that isn't, always staying in your current kind of comfort zone. So I realize that not everybody on this call listening in right now is empowered to make those decisions about where those risks lie. But I think about what you can do in your seat to lift up the choice points and always keep what children and families need at the center when you're giving those above you who do make those decisions the options and the choices that they have.
And if I could just jump in on what Miriam said, I think most of us are forced to deal in a 12-month budget cycle, right? Where we report data on 12 months. And it's hard to look at progress over time, but we're early childhood. And we know that if we help kids and families sooner, they're most likely going to have better life outcomes and require less services over time. And at the end of the day, one of the things I see as our role as the Department of Education in special education is I want every kid that goes through special education to exit with a standard high school diploma. And with that standard high school diploma, you have a lot more choices in your life. And I also believe that the supports that we give to young children and their families at the beginning of their journey absolutely influence that. And so what you're doing is so important. It's hard to get budget people to understand that the investments we're making now will have significant payoff in the future. But I think as long as we can try to continue to make those cases about what this means for young children and what it means for their learning and what does it mean for their future as wage earners. All of those things are true. And the more kids we can help and the more families we can support, the better off economically we'll all be.
That's great. And here we have a couple other questions coming in. So I'll move us to the next one, which is you've mentioned that workforce is underpaid, and Katie mentioned pay parity with K-12 teachers. But workforce pay often happens at the local level. How can states use this moment to increase or support increased wages for the workforce?
So I would love for Ruth to jump in on this as well, but states are right now sending stabilization grants to childcare providers, and states set payment rates for childcare. So they have a lot of ability to determine or provide terms and conditions on those grants or on those payments to look at what wages need to look like in that program. And then going forward, as we think about Build Back Better, we anticipate that there'll be a lot of opportunity to think about what wages look like sector-wide or what they need to look like sector-wide, and build that into the payment rates more deliberatively. Ruth, do you want to add to that?
Sure. Katie's exactly right. I mean, what we have encouraged states to do and what we have been focusing on increasingly with our technical assistance, I think is twofold. So on one hand, we have the stabilization grants, and some states have structured those grants such that providers get bonuses or extra money with additional conditions to push some of that money down to wages for their staff. So we think that is one really important tool that states can and should be using right away. And then the second piece is, of course, the provider payment rates and other ways to get wages down. Most states have not started spending their ARP supplemental funds yet. We know it takes a little while to get plans in place, but that money is quite flexible, and they could be using it for bonus payments, for incentives, for increasing payment rates. And to the earlier question of concern about the one-time nature of these funds or the sustainability issue, states have 3 more years to spend their ARP supplemental grants. And we really think that time is now. We know that these programs are hurting. Families are struggling to find childcare, and we don't think that we can afford to wait. And so we have been encouraging states to use the money in this way, and we'll continue to highlight state examples of states who have moved forward in this way, and additionally welcome, thoughts and ideas from states on how to get that message and the sort of the how-tos out there.
That's great. And we have a couple more questions coming in. So this one asks, how will family voice be involved in system design? I understand that families and children will be the center, but how do you do this without their input about how these programs work for them?
I think one of the things, and I'll be really brief, is looking at any door that a family might go through, whether it's family childcare, Head Start, childcare, pre-K, and to have those systems respond to what parents need. I think we know that parents need different things at different times, and families need different things at different times. And so we're trying to build a system that is guided by that going forward, and that recognizes that that one size doesn't fit all.
And I would just add, it's also informed by decades of research around effective family and child-centered practices. So while the moment is new-ish for us, the family and child at the center of decision-making has always been key to all the early childhood education programs, including Head Start. For Head Start, one of the perspectives that we take is we lean very much into the parent voice, understanding and encouraging programs to work to identify goals for parents around what the outcomes they would expect from the programs. And so using that, and that's all informed by the data, the research, the evidence that we've been collecting for the Office of Head Start. It's been a 56-year kind of study of how early childhood education systems can flourish and function in communities. And so I think just a reminder that while the moment is new and the momentum is new, it's informed by decades of research, of evidence-based, effective family and child-centered practices. And those same practices will guide any design around the work that we're doing as we move forward.
I wanted to chime in and I so appreciated Dr. Futrell's comments. I think what Head Start has demonstrated over decades around how to empower families to make the decisions, particularly at the program level, that most impact what they experience in the program is just critical and should be a part of what we all other, what we look to in this effort of how to learn from all of that wisdom. I would just say it has to happen at every level. All of the other decisions around resource allocation, quality improvement initiative, like again, how families need and will be, how their needs will be met in terms of the supply that's being built in the community, the hours, the settings. So I could just go on and on. I think you just have to have it at every level, and you have to resources it, and you have to be intentional about it, right? Like, so it's like, it's going beyond focus groups. It's going beyond, that are like something that isn't just episodic. So what is your strategy sort of at the, to get regular, ongoing, consistent input from families? How do you make sure that that is representative of the actual families in the community? How do you, resource families, how do you make sure that families have time, space, and opportunity to be at those tables, and are supported in making those decisions? And how does that go all the way up to the state level, in terms of decision making? I think there are examples, and states and communities, we've come a long way, I think, as a field, and time in part because I think of pushes like through this program and PDG, to do that, and again because of the example set by the Head Start program over decades. No, there's more work to do, but it does feel like this is an area where we've made more progress, and which is just, appreciate the question, is critical to where we are now with the potential of Build Back Better investments.
Well, and speaking of Build Back Better, the next question is, if we do get the most of what we're hoping for in Build Back Better, how do we make sure that we do a better job in ECE than the public schools do now for the children we have been serving?
Did you want to start, Miriam?
Yeah, I'm not sure if I fully get the question, so I'll just sort of take it in the direction that I think is like where my brain is going. One is that, we when I think about our birth to 5 system and our early care and education sector and system in states, I think public schools are a part of it. And I think that we have to do a really good job of being able to support quality across all of the settings where children and families will get their preschool or their childcare services. So I think that no one setting has necessarily the research would support a particular setting is better than another in terms of the ability to support quality. I think what we know is it has to be well resourced and it has to be supported. And so I think a lot of the examples of what we have by funding stream or by setting right now are moderated by the fact of like lack of support potentially and resources. I've been part of efforts, I know in my career, where we have been able to really support quality preschool education services in public schools, and more inclusive settings, more equitable settings, more settings that are high quality and meet the comprehensive needs of children and families. But that took a significant amount of work, as it has in other settings. So I think that we need to be mindful of that and think about resources and supports and how all of our work is grounded in the science of child development, in equity and culturally and linguistically and developmentally appropriate inclusive practice, all of these things that we mean, and that we are building understanding about that in all of the different environments where children and families will receive the services. And I think, maybe another part of that question was to think about, the outcomes potentially for low-income kids and kids of color in the K-12 system. And I think, to me, the strongest levers of where I already consider sort of the bedrock of what we ruminate on in our field around quality is exactly what we've been talking about today, is kind of continuing to be grounded in the science of child development, in equity from the beginning as we build the systems. I think my final point is, I, in Oregon, had the experience once, I'll share really briefly, of our state school chief saying the Oregon Department of Education has existed for 150 years. And I thought the Early Learning Division, which is now going to be its own department in the state of Oregon, in a few years had only existed at that time for 8. So I thought to myself, I don't know what's harder, trying to reform something that has existed for 150 years and effectuate change, or to be in year 8 of maybe where you want to be in year 20. So I think about sometimes those are the two distinctions that I make in my own mind between the systems. But I feel like we have the opportunity, because we are building this, and we are maybe in year 8, or, as Katie said earlier, the 50-year veto of Nixon, we'd be in a much different place if we were in year 50, but we are really at a pivotal moment. And so I think being grounded in equity from the beginning, and what is developmentally appropriate and culturally linguistically responsive as we build these systems, and building them with the end users in mind, we have a tremendous opportunity, I think. And I think public schools are a part of that system.
And just to quickly build on what Miriam said, kids with disabilities have a constitutional right to K-12 education. They don't have a constitutional right to preschool, because preschool is not required for all children. And so in many instances, what public schools offer for preschoolers with disabilities is a segregated programming, because that's all they can offer. What we're really hoping with Build Back Better is the notion that because we will have more 3- and 4-year-olds in publicly supported pre-K, that will create more opportunities for more kids, and certainly more inclusive opportunities. So by making it easier for everyone to access high quality early education, it's going to make things better for kids with disabilities, because they'll have more choices for inclusive care.
And then the only other thing I would add to the excellent points that Miriam and Katie already made is that, as an outsider looking in, one of the biggest challenges in K-12 education seems to be that the funding is inequitable and often reflects the resources in the community. So I think with a federal investment, we have an opportunity to create equity, and provide access to programs for families that would not otherwise have access to high quality, and kind of make sure that the funding is following the need.
Okay, so this will be our last question. And we're seeing a lot of comments come in about how much people have appreciated this. So thank you all for just the honest questions and letting me pose as they're coming in. So the last question will be this: can any of the speakers talk about how they are thinking about or planning for coordinated federal funding support to states to make good decisions regarding their specific state systems and needs?
So I think I would start by saying, we have full recognition that if Build Back Better passes, we're talking about 2 additional state programs. And so we have started kind of from the beginning, working together and thinking through what that means and how we can best support states in doing that, and thinking through those new programs. And that includes things like thinking about what kind of technical assistance might be needed, making sure federal staff are connecting, and that we're kind of setting this up in the best way possible to support states in these efforts. So education and HHS have been working closely together, and we're also thinking about how preschool and childcare would fit together, and making sure that we are aligning our thinking in a way that makes it as easy as possible for states to do the same thing. But Miriam, Katie, Dr. Futrell, others, Ruth, feel free to jump in, because this is a big question for sure.
I would just add to all the great points Katie made. We at the Office of Head Start, specifically working with our state collaborative offices, just to ensure that we're hearing and providing the training and technical assistance resources necessary as we kind of build towards the goals that Katie outlined, and ensuring that we have consistency the training, the technical assistance, and even just the information that's going out, so that there is some alignment there. So we've been very focused on that at the Office of Head Start, and even from our regional lens as well, to ensure that we're kind of anticipating to the best that we can the training and technical assistance opportunities that we could really help push out information around.
All right. Well, then with that, what we'll do is I just want to thank you all for spending the time with us today. We know this is a lot of your time, and we appreciate you sharing the vision and kind of where the federal priorities have been. So thank you so much. Thank you to the folks on the line who are sending in such great questions. Really appreciate that.